And today we have renowned spine surgeon Dr. Gosha Brusavanek answering some of your questions about back pain. Here you go.
Hello, doctor. This is Judy Sultan. I have a very bad back, and I had a kyphoplasty vertebrae cement fixation. I still have a bad back. I finally went to a pain doctor because I couldn't take the pain anymore. And she gave me a salve, and she gave me some pills to help other things. I don't know what else to do. They want to do an epidural, and he says if that doesn't work, then we're going to have to do surgery. I will not have surgery. Maybe I have to come to you. I need your help.
Judy, hi, I'm happy to help. So kyphoplasty is a procedure that's done for fractures. So if you had a fracture, it makes sense that you had that done. But if
I had 3 fractures.
you see, so if the fracture is stabilized and you are still suffering, then there must be another cause for your back pain. Now, an injection that you're about to undergo hopefully will address the most likely culprit, and then you would feel better right away if the injection was in the right spot. But in any case, I would really want you to have a clear diagnosis. From that point of view, come by, we'll take a look at the pictures, I'll examine you, and we'll make a decision. Hopefully we'll get you the right kind of an injection and you'll avoid an operation.
Okay, also he just said to me, my spine doctor, that maybe it's because I formed a lot of arthritis.
It sounds reasonable. If you have a lot of arthritis, at some point that bony overgrowth can cause pain. But I would want to be even more specific. What level arthritis, exactly where in your vertebral body, exactly what effect is it having on disc and on nerve? So it would be essential to find all that out.
Okay, thank you very much for giving me the time, and I will come in and see you. You're in Baptist Hospital, right?
Actually, I'm in Midtown, but I'm in all Baptist facilities amongst other hospitals at your service.
Good.
And Judy, what if you can just,
Ventura?
if you stay on the line, Judy, someone will be able to give you all that information so that you can contact Dr. Brusavanek's office directly.
Thank you so much.
Thank you, Judy. Now, how do you work with patients, example like Judy, to decide what's the best care or the best way of treatment for them?
Well, the best care is least aggressive, most effective. So this is a perfect example of a patient where from the beginning they're like, I'm not interested in surgery. Mm-hmm. So most patients don't want spine surgery. It would be unusual for a patient to say, hey doc, I haven't tried anything, but I want you to have an operation, to see if you can make my pain better.
Right.
So really, we always try conservative means unless there's a scary risk with the spinal cord or risk of paralysis, which is very, very rare. Mm-hmm. So you do the least aggressive, most effective thing, and for those patients that say, I can't live like this, you gotta take it away, you gotta fix it, those are the patients that then go on to surgery.
And Dr. Brusavanek, we have another caller. We have Carol from Hollywood. Mm-hmm. Hi, Carol, how are you? Are you with us?
Yes, I am.
Hi, Carol, go ahead. You have a question for the doctor?
Yeah, Mom, I'm currently having inflammation of both sacroiliac joints. I had an injection into the right joint, and I have meloxicam. And I was wondering if there's anything else I should be doing or not doing.
Sacroiliac problems are common. Did you have a fusion prior?
No.
Then I would really doubt that it's really sacroiliitis. Did the injection into the sacroiliac joint help?
Yes.
And it made a dramatic difference immediately?
No, not immediately. My problem is sitting down. When I sit down, I have pain in my buttocks, and the problem started because I sat for 6 hours in a class.
Look, I don't want to say never, but sacroiliac problems are very unusual if there isn't any history of fusion surgery. The reason is because your spine is very mobile. The SI joint is not. So in transmitting stresses, the spine will take on the stresses. the question would be, why would you have an SI problem? Now, some patients have a genetic predisposition. There's this condition called ankylosing spondylitis, which can cause sacroiliitis. And there's other arthritides, like rheumatoid arthritis, that can cause sacroiliitis. But again, these are sort of outliers. The most common source of back and buttock pain would be a disc problem, as in disc degeneration, and a history of sitting for 6 hours before this began would go along with that. I would really be certain that you have a correct diagnosis. Again, be happy to evaluate your pictures and examine you to make that determination.
Well, they took x-rays and there's no fractures, so that was good news. And when she pressed on my sacroiliac joint in my back, it hurt real bad.
That last point is not very specific. So if you press real hard, it's going to hurt. And if you press in a lumbar musculature that's overlaying the SI joint, you may think, well, that's SI pain, but it may be that those very muscles are spasming because of a disc problem right above. And I'm talking about just a couple of inches above the SI joint is your L5S1 disc. So, I question everything. I would really want to see your pictures, your MRI with my own eyes, and examine you myself, and then we could come up with a solid diagnosis.
And getting that solid diagnosis is so crucial. It's the first step towards healing your pain.